lunch, depending on what time zone you're in, but it's noon here in Minneapolis, and the sun's shining, so I have no complaints about the weather or anything else. So again, thanks for tuning in. I would imagine a lot of you tuned in last week for Kim Hunverdson's presentation on CHNAs and some of the regulatory requirements and some of the technical details of CHNAs. And I noticed during that presentation, someone stepped up and asked a question. Well, what does CHNA stand for? And I thought, well, that's probably something that is important for us all to know going into this. And I appreciated the question, because if there are acronyms that we're talking about that we don't all know, it takes some meaning and value away from the presentation. So it stands for Community Health Needs Assessment. Some of you, I would imagine, are very familiar with these, and some of you may not be, depending on your organization's experience with them. And maybe if you're newer to your organization or newer to the field or the industry, you may not have a great understanding of them, and that's okay. We're not getting technical today. We're talking more about strategy and how you can benefit from all the things you have to go through when you do your CHNA, how they can pivot or transfer or translate to bigger issues within and around your organization, and how it can really kind of be a stepping stone into strategic planning. Once again, my name is Adam Strom, and I work out of Eide Bailey's Minneapolis office. I've been with Eide Bailey for about 6 years now, and a lot of the work I do is either directly with community health needs assessments, or it's work that's adjacent or accompanying or quite similar to community health needs assessments, where most of my colleagues are numbers related people, and there's a heavy financial emphasis on a lot of Eide Bailey's work. I do more work related to people and health need of the community. And so so I'll do strategic planning for healthcare organizations. I will do market studies, community health needs assessments, volume projections, and there are often questions that come up around expansion, or do we need 25 beds here, and things like that. And there are financial details that are quite relevant to those decisions, but also people and utilization, healthcare need. Those elements are very important to consider when you're making these planning decisions. So that's a little bit of the background on what I do and what I think about. Today, we'll talk, and this presentation will be broken into 3 main parts: going beyond the minimum, and next would be the innovation mindset, and lastly, we'll get more specific around capitalizing on your CHNA. And once again, that's your community health needs assessment, which is a requirement for tax-exempt hospitals to perform or to complete every 3 years. We'll start with the first one, and if you don't know this, that's okay. It's just to kind of start to get our mind working and related. So what needs to be posted along with your community health needs assessment? And by posted, we mean made publicly available on your website and paper copies available free of charge at the organization. Is it your strategic plan, your implementation plan, your organization chart, or the nearby organization's community health needs assessments? Okay, good work, everybody. The second option was the correct answer. Your implementation plan needs to be posted and shared along with your community health needs assessment. And it's part of the process. And in short, it states which community health needs identified through the process your organization intends to meet, and how. And if there is a need or two that surface during the process that you don't intend to meet, there's a brief explanation required as to why you're not going to meet it. It could be already met, it could be beyond the capabilities of the organization, etc. So that's just to get us thinking about CHNAs and implementations plans, and later we'll be mentioning the implementation plan, so now we have a little context. So I will try and advance to the next slide. Here we go. All right, going beyond the minimum. So we tend to view the CHNA in isolation, and I don't mean Eide Bailey, I mean everybody, and especially from you, a provider or an organization standpoint, especially in the first several CHNAs you have to complete. It's a bit of a burden. It's a new regulatory requirement. It takes time and it takes money, and it takes energy and patience to learn this new formality. And so the first few aren't exactly easy or fast or cheap. We view it as sort of a once every 3 years kind of thing. And I've seen it often where an organization completes it and they want to be done with it. They want to not think about CHNAs until maybe 2.5 years down the road. And that's okay, because I understand you have work to do. You have things to do today, this week, and this month. But if you're going to put, and this is the whole idea that we try to embrace, if you're going to put the time and the money into this, and especially if you're going to get people at the table, and I'll refer to it later as the voice of the customer, if you're going to put all this work into it, why not benefit to the greatest degree possible from the voice of the customer and incorporate it into your organization's strategy? And as I'll refer to it later, your organization's health. And here's kind of the I don't know, how I think of it. The CHNA really focuses on the health needs of the community. And while your organization's mission, vision, and values and your strategy also incorporates and focuses on the health needs of the community, your strategy needs to focus on the health of the organization. And again, it incorporates the health needs of the community. But really, you have to survive in order to fulfill your mission. So there's a little bit of a difference in priority there between your CHNA and your strategic plan. There's a lot of overlap, but they are not exactly the same thing. So our thinking is that the view of it needs to evolve to be part of business, part of growth, part of improvement, and really part of everything. And if you're able, you can utilize your CHNA as sort of a guiding document to remind yourselves throughout the 3-year cycle of the health needs of the community. And your implementation plan, like we referenced earlier, can be a guiding document as to how you intend to meet some of those needs. So focus groups are a big part of the community health needs assessment process. And you get a lot of community members at the table, along with potentially board members and leadership, maybe some providers at the table, to give a lot of input. Without the legislation, without the CHNA requirement, would these focus groups even happen? And would these community conversations take place? And I think in some cases the answer is yes, but I think largely the answer would be no. And I think there would be missed opportunities to allow these conversations to take place. And there are new discoveries and new relationships and new dialogues. And as Kim has shared before, discoveries about resources that weren't really understood or identified before to meet community health needs. So these are some really important conversations that can take place. And instead of just using those for your CHNA, the idea is to use those and apply those or implement those into your strategic thinking or strategic planning. So really, as I talk about this community input, it's really about the voice of the customer. And as you browse the web, often there are pop-ups that say, would you fill out a brief survey, on how well designed this website was or how this met your needs? Sometimes if you're on the phone, if you're on hold with your cable company or your credit card company, they may ask you to stay on the line to take a survey. Even if it's only 10 seconds or 5 seconds, I'm probably 90% of the time I just decline. I don't do it. I don't want to. I don't have the time, yada, yada. And I say this because it's hard information to get and it's valuable information to get from the organization's perspective. and that's the voice of the customer. They want new customers and they want to retain existing customers. And it's the same thing in healthcare. You want to retain your patient base and you want to grow your patient base. One way to do it is to really hone in on the voice of the customer. And so once again, I'll say it again and again, the voice of the customer is so important, and it's a huge benefit that can come from these focus groups. So the CHNA focuses on gaps between health need and what services are there. But really, you can focus on anything you want. And I've seen this as we've done some focus groups with community health needs assessment task forces. You can add in other discussion points, and you can add in other questions. And this is one of my favorites. Why are non-patients non-patients? Or a similar question, why is there out-migration or leakage? People that live close to your facility that go elsewhere for care. Now, I would understand if they lived close to another organization. I could understand why they would go there for primary care or inpatient care or anything else. But what about someone who lives in your home zip code, in your hometown, and goes somewhere else? Were there service gaps? Was there a poor patient experience? Is there a poor reputation, or what else might it be? There's a story there usually, and reputations or a bad taste in someone's mouth, those things are hard to repair. I'll pivot to the right side of this slide here. These are the 4 questions as I've kind of described them. And as I speak on health need and strategy, I often bring up these 4 questions. Number 1, what is your service area? Or who do you serve? Do you know what it is? Now, a lot of us have a concept or an idea of what our service area is. But have you looked at data? Have you looked at numbers? Have you looked at all your inpatient admissions by patient zip code to really see maybe this 6 zip code area really makes up around 90% of our patient volume? Have you looked at your ED volume by patient zip code? And that really can answer the question, who do you serve? And there's a lot of nuance there. There's a service area. There's a way to define or conceptualize a market area and different things like that. But I really look at it as about 80 to 90% of your patient volume and where they reside. So I would recommend, if you're able to discern that, or if you already know it, map that and put it on your wall and just think, this is our patient base. Now we want to grow it. It doesn't have to always be this way, but that's what it is right now. Question number 2, what's your market share? So for all the people that live in that, say, 6 zip code area, are you getting 50% of the market share for inpatient activity, for outpatient, for emergency department? You're getting 20, you're getting 90? Well, what is it? And how is it changing over time? And the thing to remember as you measure that over time, if you're able, you have to keep that service area definition consistent. If you have a massive service area definition, it'll dilute your market share, meaning it'll bring it down to 10, 15, 20%, which isn't the end of the world. Just keep that the same as you measure it going forward. We've seen critical access hospitals range in market share from 15 to 65, 70%. And there's usually a story behind why it's a certain number. Question 3, are you utilizing your available data resources? So I'm out of the Minneapolis office. Here in Minnesota, we're fortunate to have a robust hospital association that allows member hospitals to get really good data on patient flow, market share, volume, activity, et cetera. It's really great. Wisconsin's very good. South Dakota is really good. And around the country, there are a variety of states that really offer a lot. It's not the case for a lot of other states as well. But what's available? Do you know what's available? Do you know what else is there besides hospital association data? And one thing I fall back on if I'm working with a state that doesn't have a lot of data available is the Medicare or the CMS Hospital Service Area File, the HSAF, HSAF. And I use it all the time. I use it this morning. And you can really pull up valuable patient utilization or healthcare utilization data by patient zip code. And it is only Medicare activity, so it's limited in that regard, but it can tell a story that can help define a service area and then also look at some market share. So that's question 3. Lastly, have you asked non-patients why they're non-patients? Do you know why your market share might only be 14% or 26 or 31 or 45? Do you know why? And there may be good reasons why some people, or I should say legitimate reasons or understandable reasons why people aren't going to your site for this type of care or that type of care. But there also may be questionable reasons and something that could be remedied there with different messaging or different marketing or reputation, if you could improve reputation or open lines of communication to certain people and things like that. So that's the voice of the customer that I keep talking about. So those are the 4 questions as I kind of think of them, and we'll reference those later today as well. Surveys can be part of your community health needs assessment process, and you're not required to do a survey, but they can be really valuable in getting the voice of the customer information and also just getting some input on health need, perceptions of healthcare services, what's there and what's needed, what's not there. And you may discover things where somebody thinks there isn't enough of this type of service, but there actually, or there's no so-and-so service in the area, but there actually is, and you provide it. So there's a messaging problem or a communication problem there. So I'd always recommend as you go through your CHNA process, do a survey. I also recommend to keep it simple. You'll get a better response rate, and it's easier for you to analyze and synthesize the survey results. And again, ask non-patients why they're non-patients. And if you're able, partner with or get involvement from social service or other organizations to do surveys at their location with their constituents, especially if they are non-patients. And that can be of benefit to you as well. All right. As we talk about task force, I think of what group or what people are on board to work on the process of your CHNA from beginning to end, or at least for the majority of the process. And we just kind of use the term task force to describe that. Often the board and some community members and some organization leadership as well. So community members and others are brought in for input and then continued work. So this is often what happens. On the front end, community members and others are brought in for input, but then the work towards the end, specifically the prioritization of health needs, is left to the organization. And that can work. We've seen that quite often. But we've seen a benefit to keeping all those involved on the front end tied in or involved all the way through the prioritization process. And people can really get that line of sight. They've shared a bunch of input, and the organization isn't saying, thanks for the input, see you later. They can actually see how the information is used and how it's prioritized and how it then surfaces and is reflected in the CHNA. And more importantly, how it's translated into the implementation plan. So you'll get more buy-in and ownership and more benefit to the community if you can kind of keep people involved throughout the whole process, specifically the prioritization process. So in like another comment about meeting health needs. So the hospital is the organization required to do the assessment, but that doesn't mean it's the only organization required to address the needs. So the hospital role can really be different depending on the need identified. And that comes up as you may identify in your implementation plan. Say this has been identified as a community health need. We don't intend to change any programming related to this because these 2 organizations are addressing it, and we're helping to make these more widely known so that it can be utilized. All right, let's take a pause here and do a polling question. So those attending CHNA focus group sessions must stay involved throughout the prioritization process. True or false? All right, so it's a little bit of a tricky question, and I would understand why anyone would say true, and I would understand why anyone would say false. So it's a little tricky. So as a rule, the focus group participants don't have to stay involved through the prioritization process. So it's really false. They don't have to. But I could see why you'd say true, because I just described that this is a benefit to the organization, to the process, and to the community if they do stay involved. So yes, we recommend that you keep people involved. So a little bit of a tricky question, but I appreciate all the input and the participation. All right, let's see. So we'll kind of pivot over here to the innovation mindset. All right, so this is an Onion article. The word innovate said 650,000 times at South by Southwest so far. This is from 2013. So Austin, Texas, 4 days into the culture and technology component of the South by Southwest Festival, event organizers confirmed Monday that the word innovate has been spoken 650,000 times thus far. Yada, yada, and at the bottom, Lucas Bryant was the coordinator. He noted that the phrases increased social engagement and potential game changer have been said 950,000 times and 230,000 times respectively. So a little bit of a humorous take on these buzzwords: innovate, social engagement, game changer. And I laugh, I appreciate this because there's this concept of what I've learned is called semantic satiation. And that's the psychological phenomenon that happens if you were to say something, take any word, say wrench, and just say wrench, 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 and say it over and over and over again. Probably when no one else is around, so I don't think you've lost it. Say it again and again and again, and after a while, there's no context anymore for wrench. There's no meaning. There's no sentence or concept surrounding it. And eventually the word loses meaning, and there's a psychological effect that is quite bizarre, quite strange, and maybe some of you have experienced it, maybe not. I'd give it a try. It's actually quite funny, and the word, your mind does weird things. So I'm bringing this up as kind of an analogy or analogous to how a lot of these buzzwords, especially innovate, can lose meaning as they are said over and over and over again. And I bring this up because I want to caution you from overusing words and concepts like that without providing detail. And also, I want to caution you from falling victim to just throwing in the towel on innovation. Ugh, I've heard it. What does it even mean? It's played out, or it's just has lost its meaning. We have a big emphasis at Eide Bailly on innovation in the last several years. We created the role of Chief Innovation Officer. And really, it's about strategy and survival, new ways of doing business, keeping existing customers, growing the business, and also enjoying your job. And when I worked in public health, I worked for the Minnesota Department of Public Health, or Minnesota Department of Health in the QI department, quality improvement. And I would do these Kaizen events, which were like these week-long improvement, process improvement exercises. And there was always this fear that we were there to fire people. We were there to lean out the organization or the process or the department or the group and lay people off. And that was never the case. A big part of it was to help people enjoy their jobs more, eliminating waste, because who wants to work in a wasteful process or in a wasteful department or in a wasteful organization? So again, back to this concept of innovation. It's valuable, it's important, it's about a lot of things, and one is really organization survival. So I challenge you to keep it meaningful rather than let it be devoid of context or meaning due to it being said over and over again. An idea here is what got you here won't get you there. And in the last 5, 10, 20 years at your organization, maybe you've achieved some success. And it's hard in healthcare, it's complicated, and you're trying to keep a lot of different parties and entities happy, well served, trying to keep it affordable, and rural especially is difficult, as you know. But the things that have gotten you here aren't necessarily applicable in getting you where you need to be in the next 5 or 10 years. Some will. Some are foundational principles, but not all of them will. And it's accepting that and acknowledging that organization-wide, with you, leadership, with everyone, that will kind of create this culture of continuous improvement and innovation that'll help you be relevant as we kind of get into the future. So what got you here won't necessarily get you there. Innovation needs to be embedded in your strategy, and strategy is hard. So really, what is strategy and what is strategic planning? Well, the challenges that go along with it, there isn't always a long-term vision. And I empathize with that. It's not easy to always be having long-term vision. You have a job to do, and your calendar for the day is likely full, and tomorrow, and this week, it's likely filling up. And for this month, you have a certain number of, you have certain things that need to get done. Healthcare is busy, and so you can't always think long-term. You have to think, how many get to the day? How will I take care of my patients, take care of our customers very well? Or how will I run this department and keep things within budget? How do I maintain this facility and do it well? So it's hard. Just like strategic planning is hard because it seems like, well, I have a job to do. I can't be doing this strategic planning retreat. Often there's a lack of focus, and there's often too much day-to-day thinking, or just thinking too little about the long term. There are a lot of tactics and no strategy, and I empathize with that. Tactics are how to do things. I often ask, what does this look like? How do we do it? Let's do something. But strategy is a little bit different. Run the business, grow the business, and transform the business. So there's a lot of emphasis, and rightly so, on running the business, getting through the day, week, and month. There's some emphasis on growing the business, but there's very little emphasis on transforming, and you'll have to transform over time, or the world around you will transform and you'll be kind of left behind. The terms tactic and strategy are often confused. Tactics are the actual means used to gain an objective or get there, while strategy is the overall plan. It's really about decision making. It's really about governing tactical execution. All right, mindsets really trigger how we perceive change. I won't go too far into this, but there's a great difference between a fixed mindset and a growth mindset. The fixed mindset really leads to a desire to look smart, and we all have some of that. The growth mindset really leads to a desire to learn, continuous learning. And I want to, what just popped up there, we all have a combination of fixed and growth mindsets. And for some people, it's more apparent. One is more apparent with some, and the other is more apparent with others. But we go back and forth depending on a lot of things. And one is, well, how much do I have to do today to survive? And organizational transformation can hopefully allow people to worry less about day-to-day, week-to-week survival and think more bigger picture. Industrial revolutions. Here's another view of where we've been and where we are. This is more nuanced, obviously. This is a abbreviated view, but with that, we've seen the steam revolution, the electricity revolution, computing now in our lifetimes, and now we're in what some are saying is the fourth industrial revolution, which is intelligence, business intelligence or artificial intelligence. I'm always asking, yeah, but what does this look like? What does this look like in healthcare? Let's not just say AI and then stop there. So I looked around and I found some things that are actually AI things that are actually happening in healthcare. Robot-assisted surgery, virtual nursing assistants, workflow assistance, fraud detection, dose error reduction, connected machines, clinical trials, or identifying participants for clinic, preliminary diagnoses, automated image diagnoses, and cybersecurity. Common use cases are medical imaging, hospital workflows, clinical decision support, some repeats from the list on the left, personalized medicine and population health. Now, you'd be right to say, well, these don't apply to us. We're not necessarily going to do robotics at my facility, right? And I understand that, and you're absolutely right. But to study these things and be aware that they're happening is really important. And also remember that things get cheaper over time. And the devices that are out there now, some actually working or being sold and used, some still in development, some just in the concept phase, are astonishing what you'll see. You'll see home ultrasound machines. You'll see handheld scanners and measuring tools and monitors and this kind of thing that will absolutely blow your mind. And I looked at some of them, not in person, but as I was in a presentation about this, I looked at some and laughed and said, that's just not going to happen. But they will, and they're getting cheaper. And so what might seem out of the reach of a critical access hospital or a rural healthcare entity might not always be out of reach. And the idea is to be in the know before the world transforms around you and leaves you in the dust. All right. So how can we implement or create an innovation mindset or a culture of innovation at the organization? So through strategy, develop strategy and align it with your mission and vision. And again, align it with your CHNA. You've learned a lot through the CHNA process. Align it with strategy. Number 2, launch a digital literacy campaign at the organization. Sounds pretty great, but what does it mean? So we'll bounce to the next slide in a minute, and we can look at how that might happen. Find strategic partners, create an innovation team. And it doesn't have to be someone at the senior level. It can be a mix of people throughout the organization. And it doesn't have to be all tech people who are involved with this. It can be anyone, newer employees, people that have been there for a long time, younger staff, older staff, anyone. You'd be surprised at what can come out of brainstorming sessions when the sky's the limit and there are no wrong answers. Allocate time to transforming your business. What does that mean? Put this as an agenda item for board meetings, senior leadership meetings. Put an innovation bullet or a piece on agendas. Get it on agenda so it's not just once or twice, so that it's ongoing. How are we growing and how are we transforming? Even if it's just a 5-minute discussion, you can recap what was mentioned at someone's education event, recap what was learned on today's webinar. You can then, any new ideas, what's happening at neighboring hospitals, and that kind of thing. So allocate time to transforming your business. But I like the idea of having a digital literacy campaign. And so I thought, what might it look like? Well, research shows that 31.8 million Americans are digitally illiterate, meaning that they are not able to utilize communication or information technologies to locate, analyze, create, or communicate information through a digital medium. That caught my eye. I thought, that's not bad. That's about 1 in 10 Americans digitally illiterate. So that's really not terrible, but it can always be improved upon. And we're not talking about the country here. We're talking about your organization. You want digitally literate people throughout the organization. So here are some thoughts. I live in Microsoft Excel, and I happen to really enjoy it. And it's a powerful tool, and I'm comfortable with it. And I'm always in an Excel window doing head scratchers or just saying, what if this, what does this compute to? And I really enjoy it, but not everyone does. And you may have an Excel wizard at the organization or somebody who really enjoys it that isn't even really using it as part of their workflow, as part of their job. So how can you get this person active and do some decision support, some modeling, some calculation, set up some pivot tables with patient data, maybe have that person define your service area, look at your patient volume by zip code, have that person find that CMS hospital service area file and start looking at market share annually and bring that report to the board as just a kind of a FYI. This is our market share as measured in this way with this service area and with Medicare data or whatever. Allow that person to use and access data. Allow that person to think through those 4 questions. And so you just may be surprised, because the reason I say find that person is because who has an innovation officer, who has a strategy officer, who has a senior data analyst at your type of organization? Not many organizations have that luxury. So find what resources you have. What might a digital literacy campaign look like? Provide more internal training and development. Provide more internal education, continued training and maybe mastery of your electronic health record and what else it may offer. Create or bring some basic awareness around AI and the disruptors. That's another word that has kind of lost meaning because we keep hearing about disruptors, especially if you go to conferences, and I go to plenty of them. What does it mean? You know, we hear Amazon is entering healthcare. Ooh, okay, yes. Well, okay, all right. We hear Walmart has entered healthcare. Okay, well, okay. But have we really understood really what that means, or what's specifically happening there? And in short, Amazon is developing a pilot program for employees in the Seattle area. It's a pilot, not countrywide for its employees, but just focused in one area. And this is focused on telemedicine and at-home visits, improving access and efficiency there. Amazon partnered with JP Morgan and Berkshire Hathaway to create Haven Healthcare out of Boston. Their mission is being described as creating easier access to primary care, easier to understand benefits and insurance info, and easier to use and prescriptions more affordable. That's what they're trying to do. And Walmart created the first healthcare supercenter in Dallas recently. I want to say maybe this year. And so they're entering that market, and that's what they're doing. I look forward to seeing how well it's working and seeing how it's impacting traditional healthcare or traditional insurance, et cetera, et cetera. So bringing some basic awareness to your team, to your organization around these disruptors. And lastly, offer some free, or locate and offer some free training opportunities. And Microsoft has a variety of these things: Windows education, cloud development. I don't know how much game development you'll be doing at the organization, but programming and such. So there's a lot out there that you can piece together and hopefully create and keep some engagement as you focus on this. What does innovation in healthcare look like? And when I'm speaking to a group of people, when I'm speaking to humans in a room, I ask them, well, what do you think is innovation in healthcare? And some thoughts that come up: well, population health, that is innovation. Some feel it's a forced innovation, but some feel it's not, and it's just the way of the future anyways. Health apps, wearables, appointment booking made easier, patient portals, and more accessible patient health records. And then I just challenge you: what do you think innovation looks like in healthcare? And these are strategic questions that are important for a lot of people to provide input to. And as leaders, how do you gather that input, gain it, and deploy it? And these are questions you could ask at a community health needs assessment focus group. What does innovation look like? So again, getting some voice of the customer input there. All right, we're on our third polling question. How many Americans are digitally illiterate, meaning that they are unable to utilize communication or information technologies to locate, analyze, create, or communicate information through a digital medium? And your options are there: 3.8 million, 31.8 million, 318 million, or all Americans are digitally illiterate. Good work, everybody. I think you nailed it. It's 31.8 million Americans are supposedly, or by this study, digitally illiterate. Not terrible, but we want to make sure your people across your organization are literate. All right, so capitalizing on your CHNA. There are thematic and literal overlaps between CHNAs and strategic plans. The anatomy of a typical strategic plan might consist of these 4 elements: current performance analysis, future market assessment, the plan design, and then the plan summary. And I really see it as the context being the first 2 elements, and then the meat of the strategic plan being the second 2 elements. And I love doing all of it, really putting out there the mission, vision, and values, your quality statements, some context on the industry, the competitive environment, summary of healthcare issues, et cetera, to the group who's doing strategic planning is really beneficial. What's your service area? Well, this is who we serve. What's our market share? It's about this, and this is how it's trending. Who are the peers or competitors we have in the area? So really, this gets people's wheels turning around strategy. And then when you move to the meat of the strategic planning process, it really helps you as you define organization pillars, maybe develop some goals, and then get really specific as we move to the right and talk about specific initiatives, who owns them, at what date should they be implemented or completed, and what are the costs and impacts of these specific initiatives. So the areas of overlap between a CHNA and the strategic plan are really looking at the service area, and in the CHNA, it's community, your definition of community, and then service area healthcare needs. And then as the strategic plan goes into initiatives, there's a lot of similarity there with the implementation plan of your CHNA. And really the meat of the work plan, again, that also is reminiscent of your CHNA, are goals, objectives, initiatives, and getting specific with the initiatives by date and the initiatives by owner. And that's, you'll see those in both CHNA and your strategic plan. So here's an example of what part of a work plan might look like. So this is an organization I worked with. I took some of the identifying information out, but the goal in this instance, and they had 13 or 15 goals. Here it was simple, to grow market share. All right, that's the outcome. Now the what is really similar to the first piece. It's increased total service area market share. In the middle, we have the objective measure, or how will we know we're successful? Well, for them, it was market share increases 2% or more 1 year from the initial baseline measurement. All right, how do we do this? We move to the right. We're getting more specific as we move to the right. We track market share on our balanced scorecard. Each quarter, market share is the market share report is shared at board meetings, as well as senior leadership meeting and managers meeting. We allow for discussion in addition to just reporting numbers. And specifically, we ask, how can we maintain and increase market share? And again, we get more specific as we move to the right here. And we talked about the initiatives, or how we'll get this, how we'll get enhanced market share. Lastly, we put people to this. Who owns this effort? And in this instance, it was the CFO. And when might this happen? Well, this is never really completely done, but when can we expect to commence our efforts? Well, in that instance, they said regular updates and reports and discussion will commence by 12/31/19. Now this is in the past, but I changed the date to be this year. So that's really the gist of what a work plan might look like. And it gets specific, and I hope it's referenced often. We recommend for it to be referenced often to track progress. What are some common CHNA discoveries? These things are likely not new to you or shocking, but nutrition and obesity care and education, active lifestyle and socialization, care coordination and referral, mental and behavioral health services, and access to healthcare. So those are the things we are seeing quite often through the CHNA process. And again, you choose which you can prioritize, and let this inform your strategic planning efforts. Should you take some, go through some strategic planning efforts. Remembering you can't do it all. You can't be all things to all people. What things are good for the community and good for the organization? I'm hoping that the picture on the bottom is more relevant to you and more accurate, where there is a lot of overlap between what's good for the community and what's good for the organization. But you have to be real and say, this is a need we're not addressing, and here are the reasons why. Some more on capitalizing on your CHNA. All right, and here's some thoughts. There are some takeaways. Review your current or recent strategic plan, and then determine and take a look and see if your CHNA discoveries are being addressed. If you don't have a strategic plan, a recent one, that's okay, and that's the case. Set a date and plan to utilize your CHNA discoveries. It doesn't have to be huge, your strategic plan. I've seen and I've helped organizations put together really big documents that is really helpful for the organization. It contains a lot of the context and a lot of the meat and a lot of supporting
work papers or appendix, and it's exactly what they wanted and need. I've also worked with organizations to develop a 2-page bulleted list of strategic priorities, and that was exactly what they wanted and they needed. So you decide what's helpful for the organization. And at one point, if you'd say you did a large strategic plan document, you might not need to do the same effort 2 years later. You might need to do an update or an abbreviated plan, depending on what you're able to do and what you want to do. The third bullet here, revisit your CHNA implementation plan. Is it actionable? Are we completing these things that we've committed to? Or is it collecting dust? If it's collecting dust, it's okay. Like I said, you have work to do. You have things happening. But don't forget to think long term. Don't forget to think strategically. And don't forget the question, how are we transforming our business? And lastly, here's an idea. Formalize your CHNA implementation plan elements. Formalize them into strategic direction by making a work plan and getting board approval. Boom, you've got an abbreviated strategic plan. And it addresses that intersection of what's good for the community and what's good for the organization. So these are just some tips and maybe some takeaways as to what you can do if you haven't, nor do you plan on launching a strategic plan effort, a giant or a large scale strategic plan effort. Lastly, at the bottom there, remember the 4 questions. Put them on your wall, maybe with some answers. What's your service area? What's your market share? Are we utilizing the available data resources? And have you asked non-patients why they're not your patients? So there's a lot of overlap, thematic and literal overlap between CHNAs and strategic planning. And I think it can be really useful to benefit to the best degree possible from all the work you put into your CHNA to really continue to think strategically and be successful going forward. So that's all I had right now, and we have a few minutes left, and I'd be happy to answer any questions or take any comments that you might have.
All right, we did have one question come through. When we conduct our CHNA survey, is there a guideline of questions that need to be asked?
Good question. A guideline question that needs to be asked. So no, because the survey is not required. However, you will want the survey to help you getting the required information for your CHNA. And you want to identify community health needs and gaps in services. And without pulling out the regulations right now, that's what's coming to mind first. And I would really base your survey questions around those 2 elements. What are the health needs of the community and what are the gaps in services? And that's at a minimum. And then, as we've talked about before, really throw in some other questions and say, well, you know, what would you do to enhance the healthcare services in the community? What would you do differently? And things like that. Why are you going elsewhere for this if it happens to be offered at our organization or locally? You could say locally to kind of keep the focus off your brick and mortar business. You could say, why might you be going elsewhere? Or why might people be going elsewhere if in fact a service is provided locally? And those kinds of things.
Okay, one more question has come in. What is the minimum requirements for board communication regarding the CHNA chip?
The CHNA chip, I'm not sure of what the chip piece is there. I apologize. But board requirements, basically the board has to approve the CHNA. But I'm not aware of any specific rules around board participation in the process. So they do have to approve it, and they have to approve your implementation plan. And then they need to be made accessible online and in person. But as far as board participation, I don't think there are hard and fast rules. I, however, would recommend that you get them involved for buy-in, expertise, etc.
Looks like they responded. The CHIP stands for Community Health Improvement Plan.
Oh, The community health improvement plan. Yeah, I'm not. Yeah, I guess by that I would think maybe of that as your implementation plan, and you certainly can, refer to that as CHIP. And I'm sorry if I'm missing any terminology nuance or other detail, but yeah, the implementation plan, I would recommend they're involved in how you prioritize needs and how you say or commit to meeting them. But they're not required. They just are required to approve it.
Okay. If you guys do have any more questions, please feel free to use the chat feature or the Q&A box located on your menu bar.
There's one thing I forgot to bring up, and I'll make this fast and let you go on with your day, but to the degree you're able, make these processes fun. And it's a hard thing to do sometimes because strategic planning and your focus groups and your brainstorming sessions, those can be stressful. They can take time, and it's hard to achieve consensus. So to the degree you're able, make them fun, make them light, bring some chocolate, bring some food. And I say that with seriousness. That takes the edge off. Bring some goofy things to set out at the tables for people to fiddle with. There are all these little tricks I've seen for facilitation or leading meetings that I think are helpful to kind of take the edge off and really get people in a comfort zone where they can contribute without fear of being embarrassed or having a bad idea. So again, to the degree you're able, make it fun. That's all for now. I appreciate you taking the time, and good luck with everything as you do your job and with everything else.
Awesome. Thank you so much. And if you guys do have any further questions, please don't hesitate to reach out. Thank you to Adam, and we hope that everyone has a fantastic day.